And so the question is, Celeste, how is this impacting our healthcare workers in our state going forward? And you are talking with the man who has those answers.
Absolutely. Troy, thank you. Dr. Ross Goldberg this morning. Let's go right to him. President of the Arizona Medical Association and District Medical Group Vice Chair of Surgery at Valleywise Health joins us now. Dr. Goldberg, thank you so much for your time this morning. And we appreciate chatting with you every week because it helps give us some perspective. Our numbers we've seen in the last week, they continue to inch up. Almost 7,000 cases here in just the last 24 hours. If you can kind of give us your thoughts and perspective on what's happening with this trend we've had in the last week.
Sure, and good morning. Always a pleasure to be on. This is kind of what we've been talking about the last couple of weeks, that worry that the Thanksgiving holiday, with everyone traveling, that we may see a spike in numbers. Well, we're kind of in the beginning of that area now, right? It's been just around 2 weeks. So this is when you start seeing people not just developing symptoms, but starting to get sick. So it is not a surprise that our numbers are going up, and unfortunately our hospitalizations are going up. These are all concerning trends.
So give me your thoughts on, let's speak about those hospital trends. People staying in the hospital longer, more people in the hospital, our hospitals are being taxed. What needs to be done right now to help this situation?
Well, right now, you've got a couple things going on. One, we had the good news yesterday that there's help on the way with the vaccine, but that's not going to help things in the acute and the short-term area. It's really the mitigation issues, areas again. The mask wearing, the physical distancing, just not being in large groups, anything we can do to prevent further spread, because whatever we do now is going to have an effect in a couple of weeks. We're going to have to ride out what's coming right now. That's kind of already been set. We don't want to make things worse. Remember, people are getting sick for other reasons. This is a busy time of year as it is, and now you've got these surges on top of it. That's what's taxing the system right now. So whatever we can do to bring that back will help us significantly.
And what are your thoughts on the shortage of nurses that are available? And of course, as we kind of see a surge here in Arizona, we're seeing surges in other states. So other states, their systems are taxed. Ours is becoming that way. What needs to happen with frontline workers, and how do we get the help that we need in our hospitals?
Well, this was a concern we've been saying for a few weeks now, that the problem is this time is it's surging everywhere. It's not happening like in a wave across the country. It's the whole country. Now, fortunately, the governor announced the last couple of times putting financial resources behind getting more staff. And I know we're actively doing it, getting nursing in. I mean, it's a competition right now is the problem. So whatever we can get in will help. But whatever resources people can get us will help. But it's really on the back end, too, of everyone kind of playing their role in stopping the spread so we don't tax our systems too hard.
So when you say competition, does that mean whatever state can pay the most to these nurses?
That's what you worry about. You worry about a bidding war coming out, right? Like if you're short supply and, you know, the demand goes up and up, the worry is that other people will start bidding each other to see who can get what. You don't want that to happen. So the idea is to try to slow the spread down so you're not looking to get into a bidding war to get extra resources.
And what are your thoughts on this, Dr. Goldberg? The number, obviously we've seen our numbers rise, but you know, some people may be requested to get tests. For example, I teach at the university at ASU, and I received an email yesterday and they said, you've been randomly chosen to go down and get a test. How many of these cases do you think might be those type of scenarios?
I'm not sure. You heard me I've been on multiple times out saying that you cannot do enough testing. Testing is a snapshot of how you're doing at that time. But the more information, the more people we know who have it and don't. Remember, about 50% of this is spread in asymptomatic people. So it's, even if you feel great, you may still be a carrier. So the more people that we know that may be spreading this, the better off we have a chance of getting ahead of it.
Dr. Russ Goldberg, thank you for your time this morning. So appreciate your insight. Be safe, be well. We'll talk to you next week.
Have a wonderful weekend.